All right. Good afternoon, everyone. My name is Maeve Williams. I am a project manager at the North Dakota State University Center for Immunization Research and Education. Today, I have the pleasure to introduce Dr. Bakke, who will be presenting this webinar titled Pediatric Vaccine Conversations, Addressing Common Concerns. Dr. Bakke is a graduate of Concordia College in Moorhead, Minnesota, and the University of North Dakota School of Medicine and Health Sciences in Grand Forks, North Dakota. She completed her residency in general pediatrics at Nationwide Children's Hospital with the Ohio State University Medical Center in Columbus, Ohio. She is currently a pediatrician at Sanford Children's Southwest Clinic in Fargo, North Dakota, and has been practicing for 13 years. Dr. Bakke, you can begin.
Okay, hi, good afternoon. Thanks to everyone for joining us. As she was reading that bio, now I've actually been practicing for 15 years, so I have a couple more years on me, and I'm happy to do this. This is something I do every day. I know this is something a lot of you do every day as well, so hopefully we can kind of work together to figure out ways to make these conversations a little bit easier. So our objectives today, we're going to review frequently asked questions and misconceptions that are encountered by healthcare providers regarding childhood vaccines. And we'll discuss some clear research-based answers, as well as like communication strategies to sort of like, you might know what to say, but maybe not how to say it. So we're going to kind of work on that. And hopefully we'll increase your ability to engage patients in productive and empathetic conversations to build trust and really to build vaccine confidence. And I mean, I know as many of you do that this is really more difficult than it ever has been. So I think this is a really timely presentation. So to start, we're going to talk about too many too soon. I think this is one that we hear all the time. I know I do hear this almost every day. We're going to go through some kind of case studies here. So Maeve is going to be my patient. She doesn't have to do voices or anything like that. And I'll be the doctor just to kind of go through in more of a natural way. All right, we're at a 2-month visit, and we'll just say this is like a new patient, like you don't know the family very well because it's their first baby. All right, Jenna looks great. She's growing and developing perfectly. You're doing a fantastic job. Since she's 2 months old, she's due for her first set of vaccines today. That means 3 shots in her legs and then 1 vaccine that's a drink that she'll take by mouth. Do you have any questions?
3 shots is a lot. I'm not anti-vax, but I don't want to do them all today. It just sounds like too much for her little body. Can we do the most important one today, and then I'll come back every few weeks for the other ones?
Okay. So this is a super common concern, right? And I want to point out a couple of things about this conversation, or one main thing, and that's that the doctor uses a presumptive approach when he's introducing the idea of vaccines. Like he's not saying, hey, do you want to do vaccines? What do you think? He's saying, this is what I recommend. Do you have any questions? And as you'll see, the mom does have a lot of questions, and you're able to sort of go back and address that as needed. But this is sort of an important technique to use. It increases vaccine uptake to sort of like assume people want vaccines unless you have reasons to believe otherwise. So too many too soon is a very, very common concern. And remember, when babies are born, they leave a sterile environment, ideally the womb, right? Unless there's something going wrong at the end of pregnancy with an infection or something, and are immediately exposed to thousands of different bacteria and organisms, literally within minutes of being born, even like while they're being born, right? Coming through the birth canal or being born by C-section. Unfortunately, for the vast majority of babies, their immune systems are well equipped to handle multiple challenges at once. So you can talk to like some, doctors, immunologists, and say, like, how many vaccines like do you think would be too much, for a baby or a kid? And it's like thousands, okay? Because they're putting things in their mouth, they're crawling around, their big brothers and sisters are coughing on them, they're at daycare, things like that. Babies are exposed to germs all day, every day. So vaccine is really like a drop in the bucket as far as the stress to the immune system compared to everything else that they encounter. Now, this is a really interesting chart, and I think it's good to know. I sort of use this in conversation a lot when I'm talking to families because I think it can be really helpful. We do have many more child vaccines now in the year 2025 than we did, years ago, like when I was a kid or my parents were kids, or certainly like my grandparents were kids. But interestingly, we have fewer antigens in our vaccine. They're like a little bit, I don't like to use the word clean, but I'll just use it like cleaner than they used to be. If you look at way back in the 1900s, the only vaccine that was given was a smallpox vaccine. And the way that you measure stress on the immune system is by looking at something called an antigen. Okay, and an antigen is what is in a vaccine or like a bacteria or a virus or something that causes an immune response. So usually it's like a protein or sugar, like part of the coating, or it kind of depends on what you're looking at. So back in 1900, when we only had the smallpox vaccine had 200 antigens in it. Okay, so it had 200 substances in it, different proteins and things that all cause an immune response. Okay, fast forward to 1960, as science progressed, several more vaccines were created: smallpox, diphtheria, tetanus, whole cell pertussis. So this is the DTP. Now we have the DTaP and the Tdap, the acellular pertussis. This is kind of the older pertussis vaccine. And polio. The whole cell vaccine, the whole cell pertussis vaccine was kind of like a big clunky vaccine that worked pretty well, but did have a lot of side effects. And it had 3,000 antigens in it. Okay, so that was much more of a stress to the immune system than just the smallpox vaccine. But we know that kids could handle it. Again, in 1980, we had some more. Fast forward to 2000, between 1980 and 2000 is when they switched from that DTP vaccine to like a DTaP or a Tdap vaccine. And then the number of antigens in that pertussis vaccine went down to somewhere between 2 and 5. So you can see from 1980 to 2000, actually, again, much less of a stress to the immune system in 2000 than there was in 1980. And then fast forwarding now to 2021, again, like, with developments, we've had even more vaccines, and you have a total of, it really depends on the vaccine brand that you use, which is why there's a range on here. But somewhere in, if combination vaccines, things like that, somewhere between 138 and 146 antigens in the childhood vaccine schedule. Again, compared to 1980, around the time that I was a baby, was over 3,000 antigens. And even back in 1900, there was more like 200 antigens. So I like to have these conversations with parents, because they say, yeah, we're protecting more, but it's actually less of a stress on his immune system or her immune system. Not to mention, I mean, they can handle it. They can handle it a lot. They can handle it pretty well, right? They used to. But nicely, our vaccines now have less side effects, things like that. So what is the problem with it? I mean, some people will be like, yeah, okay, I get that, but like, why can't I just do one at a time? Why can't we just come back every week and do one and we'll be caught up by 4 months? Well, I mean, the answer that I say is, well, you can do that. I mean, that's allowed. Like, it's not illegal. We do allow that in our clinic. I know not every clinic does, but we do allow that. But I definitely discourage it. The main reason that you should be discouraging this is because it increases the child's vulnerability to disease. Like, we want to protect them as soon as it makes sense, right? As soon as their bodies can be protected with a vaccine. Because if you wait too long, they might be exposed to that virus or that bacteria and get sick, and that's what we're trying to avoid. When you space out vaccines, vaccine errors are a lot more likely. And this isn't like a really popular thing that I like to say, but it's true. I think it's confusing. We're used to doing it in a certain way. You have vaccine protocols and things like that, and it's really easy to get mixed up. That's not the number one reason that we don't do it, but it's kind of a contributing factor. Also, more visits are really stressful for a lot of people. Primarily, they're stressful for the patients. I'm a pediatrician, so like the babies and the toddlers, like you can tell the ones that are coming in all the time and getting one shot at a time. It's extremely stressful, and they tend to hate me a lot more than the babies that get them all at once and then don't have to come back for a few months. So that's a big deal. Also, there has been some like interesting research that shows like that the stress response, like the cortisol response that babies have or toddlers have to shots, is the same if it's one shot as it is if it's multiple shots, if that makes sense. So they're still getting stressed out every time, but if you're spreading out the vaccine, they're getting stressed out more often, which of course isn't ideal. The other thing is, if you're coming to the clinic all the time, especially like in the winter and cold and flu season, you're increasing yourself of being exposed to all the junk that's sitting around in the waiting room. More missed work for parents and school for kids, depending on the age. And it's easy to get behind, right? Like when you have like an appointment every month, it's easy for things to come up and get behind. And again, that can be a problem because you're making the baby or toddler or child vulnerable for longer. Finally, like the CDC and AAP schedule is tested and vetted. The alternative schedules are not. Like one of my least favorite questions that people ask me is like, well, we'll do the important ones first. Like which one is important? Like I kind of feel like they're all important, right? I don't like to make those decisions because what if I'm wrong? And I know that the AAP or CDC vetted schedule is the vaccines work well together. And that's why we recommend it. So we'll go back to the case. It is a lot of shots. I get it. I always say this. It is a lot of shots. I completely understand. And certainly having concerns does not make you anti-vax. I don't think that. I want you to feel comfortable with whatever decision you make. So these conversations are really important. Can we talk about why I would recommend getting all of the vaccines today instead of spacing them out?
Sure.
So we give all these vaccines at a young age because we want to protect Jenna as soon as possible from diseases that can cause serious illness or even death. Spacing them out will make her vulnerable longer. Even though it is a lot of shots, science has advanced so much that the stress on her immune system now is actually much less than it was when the only vaccine we gave was the smallpox vaccine. So that's pretty cool. There's really no medicine that's better studied than these vaccines. And we take safety extremely seriously because we are giving them to young, healthy, like perfect babies like Jenna. Does that make sense? Like, do you have any other questions?
No, that makes sense. I guess we can do them all today.
Okay. Thank you, Jenna's mom. So it's not usually always that easy, right? But like being calm, like not coming back at them or kind of starting a fight is really important, and really like asking if they're okay discussing it before you discuss it too. That way you're not wasting your breath too. I guess I do want to say one other thing about this is there's a certain case that I always think about with these vaccines. And I remember when I was a resident, it was the end of my residency. I had just had my first baby. I had come back after having a couple months off and was just finishing up. And it was around this time that they switched the pneumococcal vaccine from a 7-valent vaccine to a 13-valent vaccine. And so they were kind of like in transition. So some of the babies, had gotten the 7-valent, some of the babies had gotten the 13-valent because we were in that transition period. And there's certain things that you always remember as a healthcare provider, right? And you, especially for me, and I think for a lot of parents, like the kids that you take care of that are really close in age to your kids or remind you of your kids, it really sticks to you. So I remember there was a baby that was, I think, maybe 2 days older than my daughter, who happened to be a twin who got pneumococcal meningitis. And this baby was vaccinated, but was vaccinated against the 7-valent pneumococcal, with a 7-valent pneumococcal vaccine very reasonably, because again, the 13-valent was coming out. But if that baby had been vaccinated with a newer vaccine, he probably would not have gotten meningitis. And he ended up having a feeding tube and probably was going to have lifelong neurologic disability. And then, he also happened to have this like twin sibling who was perfectly healthy. And I mean, I just remember standing in there and looking at this baby who was perfectly healthy a few weeks ago and now so sick. And it's just super sad, and now my daughter is a freshman in high school. She's got a track meet tomorrow. She's doing great. I think about these kids. Like I think about what that now 15-year-old is doing. And so again, like waiting a couple months, sometimes it really is a big deal. Sometimes like you just don't want people to live with that guilt. And so I think it's kind of important to sort of push parents in that way for that reason, because we care about their kids. All right, let's talk about, this is a really hot topic now, unfortunately, weighing the risk of measles and MMR vaccine. So we'll go to case 2.
The nurse just told me that Johnny is due for his MMR shot today. I'm not really sure I want him to have that. I was just watching the news and I've heard that we are all being misled about measles, and prominent people are supporting these claims. I just feel like maybe we should rethink vaccines. And I also heard that the measles vaccine routinely causes death, and that's just really scary.
Okay, I hear you. It sounds like you've really been paying attention to what's out there and you want to make the safest choice for your child. I think that makes sense. You want to tell me more about what you've heard and what you're worried about?
Well, the news made it sound like measles is just a normal childhood illness and we all got through it just fine before. And so if the vaccine is actually dangerous, if it's really killing kids, why would I risk it?
Yeah, I can see why that would be concerning. And you're really weighing both sides here, right? Is measles truly a big deal? And is the vaccine harmful? Would it be okay if I shared some information that might help?
Yeah, I mean, I just want the truth. It's so confusing when someone in charge is saying one thing and then the doctors are saying another.
Yeah. I mean, and I think we can all really empathize with this mom, right? Like it is really confusing. Like your pediatrician's telling you one thing, you're reading something else on the internet, you're hearing this different thing on the news, and it feels like sometimes with these cases, it feels like both sides are really equal, right? Like it's like some people believe this and some people believe that. And I mean, certainly that's true, but really like the vast majority, especially if you're looking at like healthcare providers, public health officials, people like that are very, very pro-vaccine. But again, I always joke that like most families that I take care of, like the parents had much more interesting lives than I have had, right? Like they didn't spend like their 20s and studying in medical school and in residency, working 80 hours a week, taking care of sick kids and thinking about these things all the time. For a lot of parents, for most parents, really, like with your first kid, or sometimes you start thinking about it more with subsequent kids. That's the first time you're really thinking about these things. You haven't considered it before. And then you start to do the research and it can be super confusing. So probably everyone on this webinar is pretty familiar, at least somewhat familiar with the measles outbreak that's happening right now in Texas. As of last week, the 15th, there was reported to be 624 cases in Texas and New Mexico. And we think that the real number of people being affected is actually much, much more, because we've already had 3 deaths. I believe a 6-year-old and an 8-year-old in Texas, and then an adult in New Mexico. I don't believe that we know a lot about that adult case, and a really good number of hospitalizations. Now, these are like confirmed cases, right? That are confirmed, I think, by like PCR or antibody testing, or sometimes with the epidemiologists. And typically with measles, we'll talk about this in a little bit, you get about 1 to 3 hospitalizations per 1,000 cases, or sorry, 1 to 3 deaths per 1,000 cases. And you've already had 3 deaths and only 624 cases. So that doesn't really match. And maybe it's just like a really virulent strain, or it's bad luck, or, just like some statistical anomaly. But I think most public health officials and doctors and people that are kind of in the know think like, okay, this is probably a lot bigger than the numbers are really indicating to us. And I think, I mean, 1 death from a preventable disease is 1 too many. I mean, like it's terribly sad. Like these kids did not have to die. The adult didn't have to die. We have like a very safe, effective measles vaccine, and anytime a child dies, it's a tragedy, certainly. And like when it could have been prevented pretty easily, I think, and we're living like in a modern world, in a modern country where vaccines are readily available. It's just really heartbreaking. And I think it also kind of just like indicates sort of like the stress that parents are under, right? And like just how confusing this subject can be. Now, if we look at annual measles cases and deaths in the United States, if you go back to like the early 90s, we were still having like a couple thousand cases a year. And you can see the black dots on this slide represent deaths, just 1 death. So you can see, you had about 3 deaths a year in the early 90s. But that kind of decreased over time. And in the year 2000, measles was declared no longer endemic in the United States. And so what that means is like, there wasn't measles cases in the United States that's typically being spread to other people in the United States, right? We would still get cases because people go abroad, people go to different countries where measles is still pretty endemic, and get it and bring it back. So you would see cases with that or related to that, but it's not starting in the United States. And then you can see we had like the Disneyland outbreak in I think 2014 or 2015, because there was a death with that one. And a little bit of up and down. And then now in 2025, I mean, we already have many, many more cases than we had in 2024, and it's only April. And we've had 3 deaths, which we haven't had a death from measles in this country in 10 years. And really the last few deaths that were recorded were like an immunocompromised woman, like an immunocompromised child, things like that, and the deaths that we've seen in this outbreak, and not that those aren't tragedies, like just to be clear, but those people were high risk. And now we're have seen it a couple of times already in healthy young kids. So measles is extremely contagious. It's the most contagious disease in the world. You've probably heard this before, but like you can get measles from somebody without even being in the same room as them. If someone was in this room, in this office that I'm sitting in right now, this is Kylie's office. So she had the measles and she was in here coughing and stuff and left, and I came in and didn't even see Kylie. I could get it even an hour from now. Okay. If I was vulnerable, if I wasn't immune to measles. Like the average person that has influenza, for example, and I think anyone that works in a clinic or hospital can see how quickly influenza can spread. It's always like amazing to me how that happens in the winter. Like, you know, you start to see a couple cases and then it's like, oh my gosh, every single one of these kids that's coming into the urgent care has influenza. Like they all have it. It spreads so quickly. The average person with influenza spreads it to about 1 to 2 people. The average person with measles spreads it to about 15 people. So, you know, that it's extremely contagious. And again, if one person has measles, 9 out of 10 people who aren't immune, who are exposed will also become infected. And measles does some scary things. This is kind of a newer finding called immune amnesia. And this is a condition where measles attacks some of these memory cells, like your memory immune cells, your memory B and T cells. It infects those and it causes them to like forget the other some of the infections that they've already been exposed, that kids have already been exposed to or immune to, and adults too. So what that means is after you have the measles, for the next 2 to 3 years, you're at higher risk of getting other infections, even infections that you've had in the past that you would typically be immune to. And kids that recover from measles tend to have a higher risk of dying from things even other than the measles for a few years after they were infected. So that is not great, and that doesn't happen with the vaccine, which is good. This to me is the scariest thing about measles because it's just so sneaky. It can cause something called subacute sclerosing panencephalitis, SSPE. This is rare but a fatal disease that can happen up to 10 years after you've had the measles. So say you've had measles, you recover fine. Say you get measles when you're 3, then all of a sudden you're 13, and you see things like personality changes or having like a hard time writing or speech problems. And then you end up getting like progressive neurologic deterioration, you know, with seizures and loss of ability of speech and physical abilities, and it's always fatal. And it takes about 1 to 3 years for this to happen. I've never seen this. I've never actually even seen measles. In fact, we've been joking in our clinic that we've got a few docs that are near retirement and that they can't retire because we're going to need them to pull them into the room to confirm if it's measles or not. So I've never seen it, but it's horrific. And if you talk to people that have seen this, you know, it's an extremely sad thing. And I just think too, like if one of my kids would get measles, I wouldn't be able to stop worrying for 10 years afterwards, you know, that something bad would happen from that infection. Measles, again, is really preventable. 1 dose works great. I mean, it's 93% effective at preventing measles. And then with the 2 doses, which is what's recommended, you get up to 97% protections against measles virus. Another big concern that people have about measles and MMR vaccine, of course, is does this cause autism? And that came from a study, you know, done by Andrew Wakefield back in the late 90s. It's a long story, but we'll just say like he recruited people from his kid's birthday party. There was a lot of like mishandling of these case studies. He already had a patent for like just like a plain measles vaccine instead of a MMR vaccine. So there was a lot of conflicts of interest. But anyway, when that happened, that really scared parents, and understandably so. So people stopped vaccinating. So since then, there's been many, many studies that were done to see if there is a link between MMR vaccine and autism. And this is just kind of a sample of some of the studies. But you can see there's like a couple studies done in Denmark where they have a really nice kind of like national EMR. So I think it's easy to study, you know, large populations of people. A couple studies done there of more than 500,000 kids that showed no difference in autism rates between vaccinated and unvaccinated kids. There's been studies done in the UK of more than 500,000 people, several studies done in the United States. There's MMR vaccine doesn't cause autism. I mean that's the conclusion to this. And there's been many, many studies that show that. Now, if we compare the risk here, I mean, because I will always tell parents, in patients like, well, nothing that we do in medicine is without risk, right? Like he has an ear infection, I can give him an antibiotic. He might be allergic to the antibiotic. I mean, that would be terrible, or get diarrhea from the antibiotic, or a bunch of different things can happen. But there's also a risk to not treating an ear infection, right? Depending on your age and your health and other things like that. So if we look at the effects of like 10,000 people who get measles, about 2,000 of those people will be hospitalized, which is a crazy high number. I can't even imagine how hospitals can manage that. 500 kids will get pneumonia, which is the most common cause of death. I know with some of these deaths that have happened recently, people have been like, it wasn't measles, it was pneumonia. Well, like the pneumonia was from the measles, so it definitely was a measles death. 1,000 kids will get an ear infection. There's somewhere between 10 and 30 deaths, usually from pneumonia, but also can be from neurologic complications like encephalitis. As opposed to the risk of the MMR vaccine, which isn't zero, okay, it's not none. Of 10,000 people who get that vaccine, about 3 will have a febrile seizure, which are scary, but very common and don't have any long-term effects. Around 1 to less than 1 case of like a blood clotting problem, which tends to resolve within a few months, and then less than 1 case of an allergic reaction, like an anaphylaxis. You're at greater risk of getting hit by lightning than having anaphylaxis from an MMR vaccine, but it could happen. Okay, it's possible. But again, if you compare the risk of getting measles and you compare the risk of getting MMR vaccine, it's kind of like a no-brainer. All right, so I completely understand how confusing this can be, especially when there are mixed messages from people in leadership. The truth is, measles used to be one of the deadliest childhood diseases. Before vaccines, hundreds of kids died from it each year in the US, and thousands were hospitalized with complications like pneumonia and brain swelling. Even today, in outbreaks, we still see kids getting really sick.
I guess I didn't realize measles could be that bad.
It's easy to forget because we don't see measles that much anymore, and that's just because the vaccine works so well. But measles isn't just about the rash and the fever, it can lead to death. You've probably heard that in Texas this year, 2 previously healthy kids have died from measles. And even in kids who recover, measles can cause erase hard-earned immune memory, leaving them vulnerable to other infections like pneumonia and the flu.
What do you mean?
So measles can cause a condition that's called immune amnesia, where the immune system like forgets how to fight off infections. And this can affect kids and adults after measles. So they're more vulnerable to other diseases that they were previously protected against by like vaccines or just being exposed before. So even after recovering from measles, a person can get sick a lot more often in the months and years after that.
Wait, so measles like wipes out immunity to other diseases?
Yes, exactly. So that's why after measles outbreaks, we sometimes see an increase in other infections like pneumonia and ear infections. It's like hitting the reset button on the immune system.
That's terrifying. I have never heard that before. But what about the vaccine causing deaths? That's terrifying.
Yeah, I completely understand why that would be alarming, but I really want to reassure you, decades of research have shown that the MMR vaccine is extremely safe, and that people that say that it routinely causes death, it's just simply not true. Severe reactions could happen, but they're incredibly rare, much, much rarer than the complications from measles itself. I've never seen a serious side effect from measles other than some kids will get a fever and a rash like a week or 2 later, but otherwise I've never seen anything serious.
But how do we know that for sure? I mean, isn't the CDC looking into the vaccine causing autism?
Yes, good question. So we've used the MMR vaccine since the 70s, and we have safety data from millions of children. Scientists closely monitor vaccine safety, like both before the vaccine is released and after, and there's no evidence that the MMR vaccine causes harm or causes autism. There's been a lot of studies that look for a link between autism and MMR vaccine and haven't found anything. But as I just told you, measles can be really dangerous and deadly.
I don't know. I just feel like I don't know who to trust anymore.
Yeah, I totally get that. It's overwhelming and there's so much conflicting information. I'm not trying to pressure you. Like it's up to you. I just want you to have all the facts that you have that you need to make the best decision you can for your child. If you'd like, I can show you some actual research and safety data if you want to review it yourself.
Yeah, I think I'd like to see that. I just want to be sure I'm doing the right thing.
Okay, that makes total sense. I mean, I think you're putting a lot of thought into this and I really appreciate that. We can go over the information here and I'm happy to answer any questions you have. Okay, so that's a tough one. That's that takes time to have that conversation. But even it sounds like this mom is probably not going to do the vaccine today. But you can see like she's not leaving mad. She's not leaving feeling like the doctor isn't listening to her and hearing her. And I think, I mean, you don't know, everybody has a different response, but like my thought from this conversation is that if the mom has questions, she might indeed come back and ask her pediatrician the questions instead of being like, you know what, she's not going to listen to me anyway. She thinks I'm crazy. She thinks I'm anti-vax, that kind of thing. So it doesn't feel supernatural. I certainly wasn't very good at doing this, especially early in my practice, of being like, it's your choice, it's your decision, I'm just giving you the information. I'm a lot better at doing it now, and it's kind of freeing too, I think, as a clinician, just to feel like I can give them all the information and do the best I can, but it's ultimately up to the parents. And if they feel that they have that freedom, that's usually of great benefit. All right, number 3, are these shots really necessary? We got another 2-month-old. Hey, since Mateo is 2 months old, it's time for his first set of vaccines. And we have combination vaccines in our clinic, so this means he'll get 2 shots in his thighs and 1 vaccine that's a drink by mouth. Do you have any questions?
I know today's the first round of vaccines, but I've been reading up a bit, and honestly, I'm not sure they're really necessary. We don't even see these diseases in the US anymore, and from what I've read, they were already going away before vaccines were introduced thanks to better hygiene and nutrition.
Thank you for sharing that. It's completely understandable to want to know what's best for your baby, and I think it's great you're doing your homework. Would it be okay if I talk to you through a few things that might help?
Okay, sure.
Okay. And I do want to point out for people that do this every day like me that like this doctor is incredibly gracious, and I certainly try to be too, but I also know that sometimes like people say that and you're like, oh God, oh no, like you're trying to like stay on time or get to the next patient, or you're thinking this is going to be a really quick conversation, and then it's not. So it can be super difficult. And I know that, and I get that, and I'm empathetic to that. And but the bottom line, what we need to tell the stat is like, yeah, that's true. Actually, many of these diseases are now very rare in the United States, thanks to vaccines and other advancements in public health, right? I listened to an interesting podcast last week that it was like Dr. Offit, and he talked about how like measles vaccine, for example, has been great at eliminating measles. It's also been great at eliminating people's memory of measles, right? And their fear of measles and things like that, which it hasn't really necessarily been a bad thing for public health and pediatrics and things like that. But it just kind of goes to show you the situation that we're in today. So we, of course, live in an interconnected global society, and diseases like polio and measles are just a plain right away. I was just telling Maeve and Kylie before I started that one of my colleagues had some patients that didn't want to get the MMR vaccine, ended up going overseas to visit family and developing measles, and were actually hospitalized in a different country. And then fortunately recovered and came back and were okay. And now, of course, they're immune to measles. So that's great. But, if they would have gotten the infection later in their trip and come back with it, I think we would have a whole new story. And that stuff happens all the time. So there's other infections too that we're preventing with vaccines, like tetanus, Clostridium tetani, that lives in our natural environment, and so that threat will never be eliminated. That's the one that you can get. Like people always think of rusty nails, but it like lives in like the dirt and outside and stuff. So your kids are running around barefoot, or you get a cut, or kids are being kids, right? They should be getting scrapes and cuts and bruises. We don't want them playing on their iPad all day, so I always tell kids you better have some bruises and scrape knees. That's good for you. But it can expose you to some deadly diseases. So that's one that we'll probably never stop doing. Polio, I think we were getting to the point where we're maybe going to be able to stop vaccinating for polio, but I think we've kind of taken some steps back. And smallpox, like we've eliminated smallpox from the planet, so we don't vaccinate against that anymore because it has been eradicated. And certainly vaccines are not the only explanation for, these diseases significantly decreasing or going away. Improved hygiene and nutrition can also decrease the incidence of these diseases. But if you like really look at the data, if you look at the graphs, and we have some coming up, you can see that really vaccines are mostly responsible for these big drops in disease rates. For example, if you look at this one, the measles vaccine. So the measles vaccine was licensed in 1963. You can see there was like hundreds of thousands of cases, over 500,000 cases, more or less before that. And then a severe drop after that, right? And again, we still see cases, but a significant drop. In 1989 is when the second dose was recommended. And then in 2000, we no longer, it was no longer considered endemic in the United States. Okay, how about looking at the polio vaccine? So the Salk vaccine was licensed in 1955, and that was like major cause for celebration at the time, right? And then the trivalent oral polio vaccine was licensed 8 years later. And again, you can see this significant decrease. Now that was kind of around the same time period, right? Like the 50s and 60s. But if you look at like a kind of like a newer vaccine, varicella or the chickenpox vaccine, that was licensed in the mid 90s. First it was 1 dose, and now of course, like we recommend 2 doses for full immune protection. But you can see the significant drop in varicella cases after the vaccine was licensed, and we really haven't had any like big change in like hygiene or water supply or anything since then, or nutrition really. I mean, honestly, if anything, our nutrition has probably gotten a lot worse in the 20 to 30 years, so that doesn't explain it either. So we know that vaccines work, okay? Like the vaccines can significantly decrease the risk of these vaccines. And if you look at just like vaccines overall, in general, all of them that we vaccinate kids against, like how many illnesses that we're preventing, 507 million illnesses. You're preventing 32 million hospitalizations, and a million deaths, over a million deaths a year. So it's not an insignificant impact. Now, looking at like measles outbreaks again in the United States, and this isn't something that happened, okay, but this is kind of like a mathematical model, with knowing what we know about measles and what people are susceptible and what aren't in the vaccine efficacy. So we'll just do like an example of a school of 100 children and one infectious child. So we'll just say this child isn't vaccinated. He went wherever, he comes back, he doesn't know he's sick, he goes to school and he exposes a bunch of kids. If the MMR vaccine rate at the school is 97%, which I don't think that's the case in any school in North Dakota, as far as I know, there'll be about 6 kids susceptible, and the chance of an outbreak is 16% in that case, okay? And an outbreak is considered to be 3 or more related cases. If you move down and the MMR coverage rate is more like 93%, which is probably closer to a lot of the schools that we have in North Dakota, you have 10 susceptible kids, and your chance of an outbreak, 3 or more cases, is 36%. The farther down you go, they're saying that the MMR vaccine rates, like in Texas, where the outbreak is now, is somewhere like around 80% or 80% or so, I think, depending on where you're looking. So if there's only 80% MMR coverage, there's 22 susceptible kids, and your chance of an outbreak is 64%. So these numbers really do matter. Like, our target goal is like 95% for vaccine coverage, but particularly MMR, to really reduce the chance of a major outbreak. And again, when vaccine rates go down, measles is the first one that you're going to see, because it has a very high vaccine efficacy, but it's the most contagious. So that's the one that you're going to see come first, but we'll see the other ones come as well, unfortunately. So we're talking to Mateo's dad, I think it is. You're absolutely right that things like clean water and better hygiene helped improve overall health. But when we look at the sharp, dramatic drops in diseases like polio, it happened after the vaccines were introduced. In the 1950s, polio paralyzed over 15,000 people every year in the US. And after the vaccine came out in 1955, the numbers dropped really quickly. We haven't had a case of naturally occurring polio in the US since 1979.
So it's gone?
Well, it's gone here because we keep vaccinating, but polio still exists in other parts of the world, and it is just a plane ride away. There was a case of paralytic polio in New York a few years ago. An unvaccinated adult got infected, brought it in from overseas, and then spread it around in his community, which was kind of under-vaccinated.
Wait, really?
Yeah, all it takes is one vulnerable person traveling to a place where those diseases still circulate, and then coming back to the community where not enough people are vaccinated. That's how outbreaks happen, even with diseases we thought were gone. What do you think? What stands out to you about that?
Well, I guess I hadn't really thought about it like that. I appreciate you acknowledging that other things have also impacted rates of diseases beyond vaccines, though.
Yeah, vaccines have worked so well that we just don't see those diseases anymore. But stopping vaccines doesn't mean that the risk disappears. It's just like taking the locks off your doors because you haven't had a break in. You'll notice the danger only when it's too late.
It's a good point.
So, what other questions do you have about Mateo's vaccines today?
I guess I don't have any other questions. I'm just not sure I'm ready to make a decision today.
Okay, of course. Like I want you to feel confident in any decision you make. I do recommend these vaccines to all my patients, and I feel like it's an important part of keeping Mateo on track and healthy. If you'd like, I can give you some handouts that sort of break down what we talked about today, and we can check back in his next appointment or sooner if you're ready to talk about it sooner. Would that be okay?
Yeah, that sounds like a plan. Thanks for taking the time to talk to me about this today.
Okay. All right. So that was a good important conversation, right? And we'll move on to case 4. Is the remedy worse than the disease? All right, Isaac. That's my youngest son's name. Isaac, you ready for kindergarten? I can't wait to hear about it. Before you start, you're due for some shots so you don't get sick and you don't get your classmates sick. So, Mom, Isaac's due for vaccines for MMR, chickenpox, tetanus, and polio before starting school. We have combination vaccines, so it'll just be 2 shots. Any questions?
Well, we're gonna pass on the chickenpox vaccine. I had chickenpox as a kid and I'm fine, and he's so healthy, I know he'll be fine too. Plus, our neighbor got a nasty rash after that vaccine, and we don't have time to deal with that right now.
Okay. So, question, is the remedy worse than the disease? I also had chickenpox when I was a kid. I remember it actually being horrendous. There was 4 kids in my family. I was the oldest, and like each younger kid got it worse. So my youngest brother Andy was like really miserable for a couple weeks. But what does chickenpox do? It causes a rash, like primarily, right? 300 to 500 blisters on average. But it can cause complications. 1 in 1,000 kids will get pneumonia or encephalitis. It's really dangerous for pregnant moms that are vulnerable that haven't had chickenpox because about 1 in 50 of their babies will be born with birth defects. It can cause bacterial co-infections. We don't need to talk about all my residency trauma today, but I did have a healthy 6-year-old that I took care of in residency who wasn't vaccinated against chickenpox, got chickenpox, got a bacterial super infection and almost died, was super sick, was in the ICU for a long time, came out, had to relearn to walk and talk and eat. And it was just horrendous, and it was, completely preventable. It can rarely cause Guillain-Barré syndrome, and it causes deaths. Like even in the United States, about 100 kids per year died prior to the vaccine. And again, I mean, I have seen kids, like healthy kids, get super sick from chickenpox. It's not common, but it happens. Now contrast the risk of the disease to the risk of the chickenpox vaccine, which this mom was right. You can get a rash from that. I always try to tell parents that after the MMR and chickenpox vaccines, I think I said it in one of the other vignettes, you can get fever and rash a week or 2 after those vaccines. But in that case, the rash is more like 30 blisters, happens to about 4% of patients. Certainly with this vaccine, like with all vaccines, basically you can get a low-grade fever, pain and swelling at the site of an injection. So really the benefits, it's a 97% decrease in chickenpox cases in the country. It's pretty rare to be hospitalized and certainly rare to die, at least in the United States, from chickenpox anymore. And even, I think like death is a pretty low bar when we're talking about the health of our kids too. Like there's a lot of missed school and misery and, scarring from the blisters and things like that. And kids get sick enough, from from diseases that we can't prevent from vaccines. So it's I'd like to, keep my kids healthy if you can. Here's another example. We talk about the rotavirus vaccine. So the rotavirus, similar to norovirus, okay? Miserable virus, causes fever, vomiting, diarrhea, dehydration, really bad in babies. This vaccine came out before I went in residency, so I haven't seen a lot of it personally, but I remember like, doctors that dealt with it a lot would talk about walking into like the hospital ward during rotavirus season and just like the smell of it. There was like a very specific rotavirus smell, which I'm very happy that I don't know that smell, but because you would have so many babies, that couldn't keep up their hydration when they were sick with that. You can get intussusception from rotavirus disease, about 1 in 100,000 cases that will happen. It caused a lot of clinic visits, 400,000 or so per year in the US, lots of ER visits, and 55,000 to 70,000 hospitalizations, as well as 20 to 60 deaths every year. As opposed to the rotavirus vaccine, which is an oral vaccine, which is super nice. All my patients ask me if they can get oral vaccines for other things, and I say, no, I'm sorry. Maybe someday can cause a low-grade fever, maybe some loose stools and vomiting. I feel like I don't really hear about that very much. That's pretty rare. It's pretty well tolerated. The big side effect to know about, certainly with rotavirus vaccine, is intussusception, which is that telescoping of the bowels that can happen probably from, like increased lymph nodes that develop in the gut after the vaccine. That occurs somewhere between 1 in 20,000 to 1 in 100,000 doses. All right. So again, in this case, the risks of the disease far outweigh the risks of the vaccine. 9 in 10 babies that are vaccinated are protected from severe disease. 7 in 10 are protected from any, rotavirus. And it really, really has reduced the risk of hospitalization. Like I said, I don't know the smell, I don't know it well. So like, we just don't see it that much anymore, because the vaccine is so effective. Now, all that being said, I think like a common theme through all this is it's really important to acknowledge that vaccine side effects like do exist. We don't do ourselves or our patients any favors by acting like anything is 100% safe or has no risk, because it's simply not true, and we need to be honest. And really, all meaningful medical interventions have some risk. Like I'll tell people, like I'll tell my kids, like even water, if you drink like way too much water, you can get sick, you can get, low sodium and have a seizure and things like that. I mean, obviously that's like a really extreme case, but everything has risks, everything you put in your body, right? Every time you get in the car, you might get in a car accident, things like that. And again, I said this before, but the tolerance for vaccine related complications is super low because we give it to young, healthy people. That opposed to, say, some of like cancer drugs or things. If you have stage 4 breast cancer and you're likely to die in the next few months from breast cancer, you're probably really willing to put up, or you might be really willing to put up with a lot of side effects to, say, like an investigative drug or something like that, to live a little bit longer with your to see your family. But that's when, for a person, say, that has stage 4 cancer. Now, like, it's very, very different, right? When we're talking about healthy babies and kids and adults. And so we don't tolerate a lot as far as side effects. And again, extremely serious complications are extremely rare. And you just have to kind of consider the side effect from the vaccine with the potential complications from the disease. All right, so we're back to the mom who was worried that the vaccine was going to give her a rash. I'm so sorry to hear about her child rash. I'm so sorry to hear about your neighbor. And you know what? You're right. This vaccine can cause a mild rash and low-grade fever about 1 or 2 weeks after it's given. However, it's really mild compared to the rash you get from chickenpox disease. And if he's infected, he'll probably be out of school for 1 to 2 weeks. And you're right, Isaac is healthy. He'll probably recover without issue. But if you would give chickenpox to like a newborn baby or someone who's immunocompromised, they could get seriously sick. And one of the major reasons we vaccinated against chickenpox is because women who get chickenpox when they're pregnant can have babies with serious birth defects.
Oh, well, my sister is pregnant, so I'll have to do some more research, I guess.
Okay, sure. Like, I know you don't take these decisions lightly. Can I offer you some resources to help?
Sure.
Okay. All right, I think this is our last one, ounce of prevention. So case 5. All right, great to see you today, Marta. Good luck in your soccer game this weekend. So now that you're 10, you're due for the HPV vaccine, which prevents certain kinds of cancer. I can have my nurse give that to you before you leave. Any questions?
Whoa, already? We're not gonna do that vaccine. She's only 10 years old. Besides, if she just gets regular pap smears as an adult, she won't have to worry about getting cervical cancer.
Okay. So HPV is another kind of big discussion vaccine, right? And good old Benjamin Franklin, an ounce of prevention is worth a pound of cure. That's kind of a major theme to vaccines, right? So if you look at HPV vaccine, this is an amazing vaccine. I wish people would understand that more. I mean, it prevents cervical cancer, it prevents oropharyngeal cancers, anal cancers, penile cancers, vaginal cancers, and it's very, very effective at preventing the viruses that cause these cancers. Okay, it's basically 100% protection from persistent HPV infection, cervical intraepithelial neoplasia, and adenocarcinoma in situ, and 99% prevention of genital warts. And really within 10 years of approval of the HPV vaccine, the type 6, 11, 16, and 10 decreased by 86% in 14 to 19-year-old females and 71% in 20 to 24-year-old females. So it works really, really well. And almost everybody is exposed to HPV at some point in their life. And some adults and young people clear it and don't have any issues, but unfortunately, depending on the strain you get, some will have that infection be persistent and it will go on to cause cancer in the future. And this vaccine prevents kind of the most virulent types of HPV, the ones that are most likely to cause cancer. Pap smears are great. Pap smears are important, and we still recommend them, certainly for people even who have been vaccinated against HPV, and certainly if you haven't. But what a pap smear does is it detects precancerous changes in your cervical cells. And it includes HPV testing. So if you get like a pap smear, they should tell you you're HPV positive or negative. And then I don't remember all the recommendations for that because I don't do that as a pediatrician, but it determines how often you have to have a pap smear, right? First of all, what the cells look like, and secondly, if you're HPV positive or not. And then when precancerous or cancerous cells are found, further procedures and treatment are necessary. Pap smears are basically early detection of cancer, okay? HPV vaccine prevents cancer. That's the difference. They're both important. They're both good tools to use, but I would certainly rather not get cancer in the first place than just pick it up early. And the procedures and things that you have to do if you have kind of early cervical cancer changes, or certainly, if it's progressed to like a more aggressive form, are not easy or comfortable, can cause, infertility and pain, and, you might need surgery. So again, prevention is ideal. So comparing the risks, HPV disease in the United States causes about 11 to 12,000 cases of cervical cancer, 196,000 cervical precancers. And like I said, other cancers too. Oropharyngeal cancers, anal cancers, vulvar and vaginal cancers, and penile cancers can all be prevented with HPV vaccine. As opposed to the risk of HPV vaccine. Redness and swelling at the injection site, low-grade fever. Again, these are side effects that you see with every vaccine. And then anaphylaxis, which is extremely rare, like around 1 in a million to 3 in a million cases. And then looking at MMR vaccine, it's 97% effective, like we said before, at preventing measles. But how do you treat, measles if you get it? Is that better? It's a virus, so antibiotics don't work against the measles, and treatment is basically supportive. Sometimes you can get like a bacterial super infection. That happens with a lot of viruses, like influenza. You can get like a bacterial pneumonia afterwards, or an ear infection. Same thing with measles, and then you would treat with antibiotics for like the bacterial secondary infection, right? But measles in and of itself cannot be treated with antibiotics. And again, like we talked about before, 1 in 5 unvaccinated individuals are hospitalized. Around 1 to 3 in 1,000 will die. And then we talked about the other risks as well. So, there's a lot of press now talking about using vitamin A to prevent measles, and cod liver oil, which is really high in vitamin A. So that's kind of been like a recommendation that's been floating around. And it's kind of one of these things that it takes like a little bit of effect and it mixes us up a little bit. Because vitamin A is recommended to treat measles, okay, by the AAP, the World Health Organization, some of the infectious diseases group, because there's some evidence in African countries that vitamin A therapy can help to reduce measles mortality. So it can reduce your risk of dying and reduce your risk of severe disease. There's a questionable benefit in more developed countries. It seemed to work better in Africa, where maybe nutrition might not be as good or things like that, as opposed to other countries, but still it's recommended. And the dose of vitamin A that's recommended is 200,000 international units of vitamin A once a day for 2 days. If you did that with cod liver oil, it would be 45 teaspoons of cod liver oil daily for 2 days. So if you've ever tried to get your kid to take any medicine, I've actually never taken cod liver oil, but I don't think that it's very tasty. And even something tasty, 45 teaspoons, like, no, thank you, right? So again, it can be effective at treating measles and preventing severe measles, but there's no evidence that it prevents it. And vitamin A is one of those fat soluble vitamins, right? D, A, K, and E are all fat soluble. And that means you can overdose on it. That means you can get too much and your body can't get rid of it. So you get something called hypervitaminosis A, which can cause blurred vision, headaches, and liver damage. And in the press, there's been reports of cases of kids who are taking, high levels of vitamin A for a long time to prevent measles who have ended up having some hepatitis and liver problems from that. So I wouldn't take vitamin A to prevent measles. There's no evidence that that'll work. Then let's talk about like a different vaccine preventable disease, polio. So the polio vaccine is basically 100% effective at preventing polio. The treatment for polio, if you get it anyway, if you decide not to vaccinate and you get it or your kid gets it, is basically supportive. Because again, this is a virus, so antibiotics don't work. Treatment is basically like a ventilator, physical therapy, braces and wheelchairs, things like that. The disease kind of has to take its course. So that's a really scary one. You don't want to get polio. Hib vaccine. Again, this is something that I haven't hardly seen in my career because of vaccines. It's very effective, 95% effective at preventing Hib after the primary series. And the incidence of Hib infection has gone down 99% since the pre-vaccine era. So Hib, Haemophilus influenza B, is treatable with antibiotics. However, hospitalization is basically always necessary. And even with antibiotics, 20% of survivors have long-term neurological sequelae, even with treatment. I have a good friend who's also a pediatrician who was hospitalized with Hib meningitis when she was a toddler. I think, I can't remember exactly how old she was. And she obviously recovered and did well and is a physician now and bright and perfect. But she talks about like her mom telling her that her roommate or the kid that lived across the hall also had Hib meningitis and is in a wheelchair and has severe kind of neurologic complications from having Hib meningitis. So it's just not really like a risk that you would ever want to take for yourself or your kid. All right, but we're back to talking about HPV. I get it. 10 seems young to be thinking about this, but we want her protected before she's exposed. The vaccine's safe and kids have a great immune response. And remember, pap smears work and are really important, but they just detect cancer early. This vaccine can prevent her from getting cancer at all.
This seems so soon. If you don't mind telling me, have your kids gotten the vaccine?
Yeah, I don't mind at all. And they absolutely have, or my older 3 have that are old enough. In fact, every pediatrician in our practice has given this vaccine to their own kids when they were old enough. I certainly wouldn't ask you to do anything for Marta that I wouldn't do for my own child.
That's really reassuring. Okay, we can do it today.
Okay. So another successful visit. That's about it. So, I think like in conclusion, kind of presuming that patients will want the vaccines presenting it like that way, and really having like a little mini script or something can be really helpful in responding to these concerns. Being calm, reminding yourself and reminding your patients that really this is ultimately their decision. Like you get to provide them with all like the very important science-backed information. They get to decide if they want it or not. But with vaccines, in almost all cases, unless there's just something unusual about a child's health or history, the benefit is going to far outweigh the risk. So I think we maybe have room for like one question, Maeve. I don't know. It's just right at one, so you'll have to let me know.
Sure. Yes. Thank you so much, Dr. Bakke, for this incredible presentation. I think I might just throw out one question here. I guess we are right at one, but just one quick question. So with too many too soon, do you find that parents are concerned about the number of antigens in vaccines, or are they more concerned about the extra chemical ingredients, or even just the perceived extra painful pokes?
Yeah, I don't think most parents like even understand what an antigen is, it just feels like a lot. I think it, and I get it. Like you bring your like perfectly healthy baby in with their chubby thighs and we're asking you to kind of hold them down and let nurses inject things. So I think it feels wrong. It feels like too much. And then when you look at the list of things you're preventing, and depending on if you're doing combination vaccines or not, it feels like a lot. And so I think everybody's different. Obviously, people have different concerns, but I think I think that's just like the main concern. Like it feels wrong, and I think that makes sense. And they kind of just need that reassurance. And by explaining things real simply, like antigens and things like that, I think can help them to feel more at ease.
Perfect. Thank you so much, Dr. Bakke, and thank you everyone for joining us today. We look forward to seeing you at our next webinar.
Thanks, Maeve.